So there is one thing that patients get wrong most of the time, which is assuming all surgeries are the same. For example, if there was an operation which failed, it didn't go so well, it is just natural for sure to fear, but you cannot make that fear decide what you will choose for your life. If at all you have to undergo a certain form of a surgery. So the prudent thing to do would be to understand, ask your surgeon as many questions as possible, so that at least you're able to understand what is different in the operation that maybe you're undergoing or your loved one is undergoing, instead of making an assumption based on what didn't go right at certain point. So the first classification we'll be looking at is emergency surgeries. So emergency surgery is a matter of life and death. So this operation has to be conducted almost immediately to save the life of the patient, or even to avoid further damages to the body in general. A good example, we see this in emergency cesarean section cases, whereby a doctor has to make a very swift decision about rushing the mother to theater, either to save the baby or save the mother, or save both of them, and even prevent further damages to both the baby and the mother whenever there is a complicated delivery. Another classic example is road traffic accidents. Those patients who suffer severe head injuries sometimes have to undergo a very quick operation to relieve pressure on the brain, so that they don't end up with brain damage or even other form of organ failures because of sudden bleeding and trauma to their body. So another classic example or classification we'll look at is elective surgeries. So elective simply means there is an advantage of time, like you're not in a hurry to perform the surgery. It may be very important, one of the most important surgeries, but not an urgent one. So the client has the opportunity to discuss it with the surgeon, discuss with the family, analyze the whole situation, and they can even decide where they need to be done, what exactly need to be prepared before the surgery. Maybe there are some lifestyle modifications to be made, so you'll be able to do that in readiness for the surgery. There could be medication as well in the planning phase, so that you're able to fully prepare for the surgery. So elective simply means there is the advantage of time. It is not so urgent, but it is equally important for you. So a good example of elective, still we have cesarean section cases where a mother will decide, will choose, I want to deliver my baby through surgery at this hospital on this date. So there is the advantage to the patient and family. They are able to discuss prior, make decisions, and fully understand the condition even before the actual surgery is performed. So another classification of surgeries is either a major surgery or a minor surgery. So a major surgery simply means there is an extensive operation which is done on your body. It could be opening a larger part of your body, or it could also be a complex surgery such that the surgeons need to take very many hours, talk of like 8 hours, talk of even more than 12 hours sometime. And example of cases whereby you'll find this is in the cases of brain surgeries, or also the back surgeries, whereby there is a longer period of time spent in theater while performing the operation. And remember that it doesn't matter whether the operation is taking a shorter period of time or longer period of time. That should not be the source of your fear, because before any surgeons decide to go into theater to perform a certain operation, they already have a conference as a team and decide. By the time you're doing that surgery, the whole plan of care, of treatment has been decided on. So all you need to do is to understand and be able to go along. And of course, once you have understood, it's much easier even to deal with the aftermath, the healing process which follows after the surgery. So another form of surgery classification is the minor one. So minor means there is a shorter period of time spent in the theater. So you're not going there for longer periods of time. Most of the time it's done by one surgeon as opposed to major, whereby you may find several surgeons coming in to perform one operation. So in minor surgeries, there is a limited period of time spent in the theater. And secondly, also there is no so much a larger part of your body doesn't have to be opened up. And with advanced technology nowadays, you'll find doctors using special tools which are used to just create a small incision or a small cut on your skin, and then the tools are used to advance and perform the operation inside the body. A good example is the stomach surgeries, whereby tools and cameras will be used.